Scapular mobilization involves applying direct pressure to the shoulder blade by a physical therapist in an effort to restore normal movement in the scapula. These forces can be gentle and back and forth in motion or more forceful and held longer, depending on the type of mobilization technique being performed. Ideally, increases in scapular movement should help improve shoulder range of motion, reduce pain, enhance overall function. To perform this hands-on technique, the therapist typically positions you on your side with your arm resting on their own arm at a 90-degree angle. Once manual mobilizations have been performed on your shoulder blade, scapular exercises are typically prescribed by your physical therapist. These techniques focus on maintaining the newfound movement in your scapula and on increasing the strength in several of the shoulder and trunk muscles that attach to it. While there are many different exercises that can help with this, among the most common are shoulder blade squeezers. Gently squeeze your shoulder blades in the down and back position and hold them here. Shoulder rolls. Slowly but steadily roll your shoulders in a backward circular pattern. Band resisted rows. With a resistance band secured in a door, make a rowing motion as you pull backward on both ends and squeeze your shoulder blades together. Resisted shoulder extension. With your elbows straight and your arms by your side, tug backward on both ends of a resistance band as you move your scapulae together. Side-lying external rotation. Lie on your side with your elbow bent at 90 degrees and your palm resting on your stomach. Without moving your elbow from your body, rotate your hand away from your stomach and into the air.